Hi, ma'am. A very good afternoon.
Good afternoon to you too. How have you been?
It's all good, all good.
All good.
See, all set.
Yeah. All set. All okay?
Uh, yes, all good, all good. You can see you there. My- So,
Okay.
all the mommies who have chat, a good afternoon. Thank you so much for such a fabulous response. So many questions that you all have shared with us. At Nutrizoe, we really believe in empowering women, enlightening women by creating awareness around faced by women. So let me take this opportunity to introduce today to our expert, a veteran gynecologist, fertility, who comes with experience of more than 3 decades and holds an exhilarating journey as a doctor. Not only this, she is an author, a women rights activist, founding member and trustee of Women Empowerment Foundation, currently founder president of PCOS Society in India. She is recipient of numerous honors and awards, including was only to be honored with the prestigious Distinguished Medal Award for services towards women's health at the World Conference by FIGO in 2012. Recently, was awarded with Mahatma Gandhi Award in 2021 for social good and impact for good health, well-being, and gender equality. Trust me, feminism isn't about making a woman strong. Women are already strong. It's about changing the way the world perceives that strength. Today we have an expert who has changed the world, the way world see at the women. Please welcome Dr. Duru Shah, all the way from Mumbai. A very warm welcome, ma'am.
Thank you so much. Thank you for having me here. I'm delighted to be with you.
Oh, ma'am. So today we are going to discuss with Dr. Duru how can a woman improve her fertility, what all she can do for that. So before we start with the solution, I will request you to take our mothers with a little introduction. What is fertility and what is infertility?
Okay, I think that's a very valid question because not many people know about what is fertility. And the way I can explain it is that if there is a couple who lives together for more than a year and they do not use any contraceptive, and during that 1 year they've been living together, they're sexually active, not traveling away from each other, and always being together. So, in short, if we have a situation like this, and if if the lady does not get pregnant in that 1 year, then we say that probably she has infertility. Now, whether the cause, whatever it may be, but the diagnosis is when you live together for a year, do not use a contraceptive, are sexually active, and still do not conceive. The reason of that 1 year comes is because 85% of couples, within 1 year they would get pregnant, but 15% don't. And it's those 15% is whom we want to target.
Okay. So, ma'am, help me understand from last decade, we have been seeing a very big amount. Like it's an increase in the infertility cases by 10 to 50% every year. So, what is the reason behind this increase?
See, the thing is that there are many reasons for infertility. I mean, if you go back about 30, 40 years ago, infertility was mainly because of some tuberculosis or some injury which has occurred to the fallopian tubes, and the fallopian tubes have got blocked. That was the real high risk of infertility. Usually, say in a sort of a rural area where the woman probably has had a delivery or an abortion wherein proper care was not taken, there was no proper asepsis, there was not enough hygiene, and infection occurred, and when that infection occurred it blocked the tubes, and that is the
Right.
commonest reason we used to see. So whilst we were training, by the way, I'm practicing for more than 40 years now, and I was in training maybe 50 years ago. So the question was that in those days we saw a lot of patients who had tubal infertility where something was wrong with the tubes. But today we are seeing remarkably different type of patients. We, at least in the urban sector, we are seeing more career women who are having problems getting pregnant, and
Mm-hmm.
probably because they are getting older and then they are trying for a pregnancy. They are
Right.
probably getting married late in life. They are
Mm.
probably divorced and they're getting remarried again. Or there's work stress and there's not proper sleep at night. There is different especially air hostesses, that's all, when they have different time changes, the
Right.
rhythm of the brain gets affected and it affects fertility. If they are smoking a lot, their eggs get affected. The eggs in the ovaries get affected, and therefore those eggs are not able create good embryos or healthy embryos. So, in short, there are many reasons because of which today age has become an issue. So, smoking, alcohol, being overstressed, not eating healthy, putting on a lot of weight, obesity, that causes
Mm-hmm.
problems in the females. And in the males, again, it's the same story. Lot of many of them actually I'm finding are going to gyms and taking all kinds of protein products, which sometimes are not the best for them. They need to check what they are having because those products may contain something which can affect the sperms quite badly. As a matter of
Oh.
fact, we had one of our patients like this where the husband was going through, he was getting married to a lady much older than him, and
Mm-hmm.
she was a foreigner, and he was a young man who was building his muscles to impress her. And he was taking this high amount of protein and some steroids. He went to some doctor to build his muscles. His sperm count showed zero, zero,
Oh.
completely zero. And I couldn't figure out why. Then when I asked him all the questions, he came up with the story that yes, he's taking steroids, etc. Then we stopped everything. Everything came back to normal, and they had a normal baby. So in short, what you're consuming, you need to be sure about. What you're picking up from the shelf and taking without a medical supervision is what something you need to look into. And therefore, these are areas we need to definitely address, both in the male and in the female.
So, as ma'am, you just said under medication thing. So, help us understand what is the role of a menstrual cycle, because many of the times mothers do not, women doesn't understand also that missing, not having time for menstruation are also affecting fertility.
It's true. Like, say, if you're not getting your periods in time, that means that your ovulation is disturbed. Means the egg release, which you see, a woman releases one egg in a month, and that usually happens around the 13th, 14th day of the menstrual cycle. If you
Right,
count the menstrual cycle from the first day of your period to the first day of your next period, which is a 28-day cycle. Now, a
right,
normal cycle for a woman may be even a 25-day cycle. She may be always getting it every 25 days, or she may be getting it 32 days. But we always
right.
count the cycle from the first day of the period, of this period, to the first day of the next period, and that's how the cycle is counted. So, in short,
Right.
if you've got a 28-day cycle, then the ovulation occurs or the egg release occurs on the 14th day of the cycle, which may vary a day or two here or there depending on so many factors which affect ovulation. Ovulation means an egg is released, and that egg, when
Right.
it meets the sperm, only then can a pregnancy occur. Otherwise, that egg, if it does not get meet a sperm or does not get fertilized by a sperm, then in 48 hours it dies a natural death, and it just sort of degenerates and disintegrates into the reproductive system. So, in short, a menstrual cycle, when it's normal, it more or less sort of suggests that yes, the lady has is probably ovulating. It still doesn't confirm it, but it may
Right.
be that she's having a normal ovulation. But if she's getting delayed cycles, say in a patient who's got polycystic ovaries, if she's been getting
Mm-hmm.
periods every 2 months or 1.5 months, she's getting a chance only once in 2 months to get pregnant because she releases an egg only once in 2 months. Whilst a woman who's getting her period every month, she's getting one chance every month. So she gets 12 chances a month to get pregnant. And in a woman who's got delayed periods, she's getting that many less chances of getting pregnant. On the other hand, with a man, every time he releases sperm into a woman, he can make her pregnant. And he has to release millions of sperms to fertilize that one egg. Now, this is what I joke with my male patients or patients and tell them, you see, that one egg is so strong, it can carry on a pregnancy. You need to produce millions of sperms to get to that one egg with one sperm to have a baby. So we feel that the female gender is stronger even where the egg and sperm is concerned.
Feels like I know how strong you come when it comes to this topic, and you support them by going out of the way.
Yeah. Yeah.
So also,
So
Ham said there are so many OTC medicines are available for like painkillers, paracetamols, and all these. Is there any side effect of these medicines with fertility?
yeah. You know what happens with ovulation? The egg gets released from the. We say it so
Mm-hmm.
simply that the egg gets released, but what makes that egg get released? So, there are a lot of hormones which occur. There's so much of chemicals which get released inside the follicle in which the egg is. One of the things which
Mm-hmm.
occurs is that there's a release of something called prostaglandins. It's a chemical which helps to break open that follicle so that the egg comes out. Now, suppose you take an NSAID, you take a medication like, say, a Combiflam, all right, anything, or a Brufen. These are tablets which are, sort of inhibiting or stopping the release of this prostaglandin. So, what can happen is if you take that tablet around the time of ovulation, you may prevent the release of the egg from the Graafian follicle, from the follicle. So I hope I'm
Right.
clear. So in short,
Yes.
if you're taking a medication which is preventing ovulation, it's going to come in the way of getting pregnant. So we normally recommend women that if they have any pain, if they have any headaches, if they have any issues, then they should be taking just a paracetamol rather than taking a medication with, like say a paracetamol is like a Crocin or a Tylenol, which is safe. But if you take something
Mm-hmm.
which contains an NSAID, which is an anti-inflammatory medication, it prevents the release of prostaglandin and therefore affects ovulation. And if ovulation doesn't occur, the egg doesn't come out of the ovary, it never meets the sperm. So that's
Right.
one can cause a problem. There are other medications which we give actually to improve fertility. So there is something like aspirin, simple things like aspirin. If we give aspirin at the time when ovulation is happening or has happened,
Mm.
and we give it following that also, it helps increase blood flow in the lining of the uterus so that it helps to improve implantation. For that, say the egg has come out, it has met the sperm, they've made an embryo, but all that occurs actually in the fallopian tube. It doesn't occur inside the uterus
Right.
because the egg comes out from the ovary, gets into the fallopian tube, the sperm comes from the vagina, climbs up the uterus, gets into the fallopian tube. The two meet over there, that's the meeting point. That's where the egg gets fertilized. The fertilized embryo, as we call it now, the fertilized egg is called an embryo. That
Mm-hmm.
starts multiplying. From one cell, it becomes two cells, 2 to 4, 4 to 8, 8 to 16. And then it starts coming into the uterus where it becomes a 32 cell embryo. And that is the time, that is 5 days after ovulation, the embryo comes and implants itself or sticks inside the uterus and into the endometrium or the inner lining of the uterus. And that's where it sort of implants and grows. And if we do give aspirin around this time, it improves the blood flow and it helps in the implantation process. So simple tablet like aspirin, a very small baby aspirin helps at that time to increase the blood flow and improves the chances of implantation.
Wow.
So medications can help in different ways.
Yes. Yes.
These are the
Definitely.
ones
But
which you get OTC. These are OTC products, right? These are OTC products. So that's why I'm talking about this. Otherwise, there are a whole lot of medications which the doctor would give to help with the
Right.
ovulation and to help with fertility.
Definitely. So it should always be guided by a expert what you're taking. Should always be.
Absolutely. Yeah.
So all the who have joined us, if you have any question related to fertility, please share with us. We'll take all your questions. Moving forward, as we the fertility issues, what are the problems, but exactly when should they seek for help?
Yeah. I think that's a very good question. You see, in the past, we used to always say, wait for 1 year, make sure that there's no infertility, and then go to the doctor. But today, you see, since women are, planning their pregnancies quite late in the day, the concern we have is that, the best of the eggs or the best quality eggs, they sort of come out of the ovaries much earlier than the unhealthy eggs. So you do have two kinds of, different kinds of eggs in your ovaries. And some of them are post-mature, some of them are mature, some of them are immature, and some of them are normally growing. So the ones which are the most healthy, they come out first. So in your younger days, you get the healthier eggs coming out of the ovaries. So we release only one egg at a time in a month, right? But a woman starts releasing her eggs after she has attained puberty, and she stops releasing eggs by the time she's menopausal.
Right.
And 10 years before menopause, and she's born with a limited number of eggs in her ovaries. It's not like you can go on producing millions of eggs. You're born with a certain bank, which is bank account which God has given you, and you once that account is over, which you've spent, there's no more left. You can't make more eggs that as of today, but you can borrow eggs from someone else. So that is called egg donation. But coming to the same patient, if she's older in age, I'm concerned about the quality of her eggs, right? So if she's 33 and if she's not yet conceived and she's married, she's married for 6 months and she's still not conceived, I'm not going to wait for 1 year to tell her that you need to take treatment, because with every cycle she'll be losing out the best of her eggs, and what will be left will be the eggs which are not the best, and therefore it may give, she may have trouble getting pregnant when she wants to get pregnant. So in short,
Right.
that's when a couple comes to me, I would say at least that, okay, if you're not planning a pregnancy now, I will at least evaluate you to see how much you can wait. Let me at least do
Right.
your test. We do a sonography, we do the blood test. And if we feel that, she can wait for 6 months, no problem. But if we feel that the reports are suggestive that, she's already lost quite a few of her good eggs, then we recommend to them that to start treatment immediately. But you may have a young woman who's working, who's got a career, and she's working in an office and she's still not found the right partner. She's not found the right husband to get married to or to have a baby with. So, in short, if that happens, then we don't want them to wait till they get married. Otherwise, they're so stressed. Oh God, then they sometimes get married to someone not of their choice. They get married because they have to get married, the biological clock is ticking away. And that is where again science has come to the rescue. We recommend to all girls at least that by the age of 30, 31, if you really haven't found a partner, and if you don't know when you'll get married and you don't know when you'll have children, just freeze your eggs. It's like an insurance plan. You put it away, you get it out of your head, you find your right partner, get married to him. Try on your own. If you still don't get pregnant, then you've got this eggs banked away, which you can use, which are healthy eggs at a younger age. So this is something which is really useful and for people to know, because a lot of women today come to me only after they are 36, 37, and they say, now I want to bank my eggs, which is not the best thing to do, because the best eggs have already left you and gone away. What you're banking is your second best. So that's exactly what I would like to say. And in our country, unfortunately, we reach menopause a little early, and at about the age of 48, that's the average age. And 10 years before menopause, that is at the age of 38, we have lost most of our good eggs or the healthy eggs. So by after 38, it starts getting difficult to get pregnant. with the eggs you have. I'm just giving a mean figure. It's not necessary it is
Right.
38 for everyone. There are women at 40 also getting pregnant on their own. So it's not like one figure. There's no need to panic. And the thing is only that every woman is different. I'm giving you the average. And if you compare it to the Western population, they reach menopause at the age of 52 average, and therefore their quality of eggs gets deteriorated after the age of 42, right? And our women
Right.
start losing their good eggs by the age of 37 or so, 37, 38. And we used to
With
always
difference of
wonder that why the scientists used to wonder why the Asian population has lower fertility rates at the same age as compared to the Caucasian population, the Western population. And today we have an answer to that, that it is because of our ethnicity that we reach menopause early, and therefore our eggs are not the best quality after the age of 37 to 38. So that's why we tell women that freeze your eggs early or get pregnant early, one of the two.
which is okay. But you should, so in short, there's no age of seeking help. You should come to a doctor as early as possible.
Absolutely,
Maybe
absolutely.
age 29, you go to a doctor, consult and take a guidance and freeze your right,
Absolutely,
right.
absolutely.
So I'm also help me understand how healthy lifestyle and what are the effects on the fertility.
Okay, so we've got lifestyle. You see, most of our girls today are really exercising and really keeping themselves healthy. I'm very proud of them because they are regularly exercising. But there are some women who don't, who just forget about themselves. They focus themselves on their careers and they focus on their families, and they've not got time for themselves. So you see, obesity sets in. And when obesity sets in, there's a lot of fat which accumulates in the body. And when there is extra fat in the body, that fat is also producing extra estrogen in your body. So the fat is also considered as an endocrine gland today, which is producing a hormone. So when these hormones which get produced by the fat, they give rise to something called insulin resistance, wherein
Okay.
the whenever you eat sweets, okay, or whenever you eat food, whenever you eat anything, the body has a natural mechanism of getting rid of that sugar from the blood within 2 hours. And that happens because the body secretes insulin in the body. That insulin gets rid of the sugar and brings it back to normal. But when you have insulin resistance, what happens is that insulin cannot function the way it needs to function. It is not able to bring down the sugar levels or the levels which are come up in the blood because of eating. So that insulin, the blood sugar remains high in the blood and it does not come down in good time. And steadily, this insulin resistance then converts into diabetes. So when you have insulin resistance, what is happening is the insulin levels keep on rising in the blood to maintain the sugar levels. It's a compensatory rise in order to maintain the sugar levels. Like it's something like this, like if you're having a tug of war, right? There are two strong teams on two sides, both pulling at each other. Everything is under control. Nobody moves from this side to that side. But if you have a stronger team on one side, it's pulling towards that side, and the team which is weaker is getting pulled. It's something like
Right.
this. If your insulin levels are good and they're functioning well, it helps to bring the sugar down when the sugar goes up. But if the insulin is not working well, the sugar levels go up. And as the sugar levels go up, the insulin goes up higher, trying to control it. So, with that
Right.
insulin going up, you go on putting on weight. The more insulin in your body, the more weight you put on. So, in short, that obesity comes in the way, increases insulin, and makes you get more and more obese. Now, because of all these changes in the hormones, you will find it affects the eggs, it affects the embryos, it affects the implantation, it affects every part of fertility. And therefore, it is well known that if you lose your extra weight, even if you lose 10% of your weight, the chances of getting pregnant on your own increase by 25%. So the first step in the direction of weight gain, I mean of having a pregnancy, is lifestyle changes. Get rid of your
Right.
extra weight and you'll get pregnant very quickly. If of course, if everything else is normal. So that is the first step we need to do. And even the lean patients need to exercise. It's not only about obese. Even the
Mm-hmm.
lean ones need to do, because the muscles also help in bringing the insulin down. So lean patients, we recommend doing weights and doing resistance exercises, whilst obese patients are asked to do cardio and getting rid of their fat.
Right.
So that's how it affects fertility.
Of course. Everything is connected, well connected. For everything, we need to be fit, healthy. That's the one
Absolutely.
system. So, ma'am, help me understand. As I was reading about this particular topic, somewhere I just read about Mr. and Mrs. Sunshine. Sign. So, what is the role of sunlight in fertility?
Okay, so sunlight is important for us. As a matter of fact, if you see in India, we have so much of sunshine. But still, if you
Right.
check everyone's vitamin D, the vitamin D is very low. Especially women who are covered from head to toe, their vitamin D is even lower. So, in
Right.
short, vitamin D is a vitamin in the body. Today, it is considered more of a hormone rather than a vitamin. So
Oh,
vitamin D is now considered more as a hormone because it has got action on various parts of your body, including the reproductive system. So if vitamin D is deficient in your body, then it affects again fertility by acting on the egg and the sperm and the embryo. So how does that one knows that is because when scientific studies are done, they have found the receptors for vitamin D in all these tissues. You see, whenever a hormone acts on any part of the body or any part of the cell,
mm-hmm.
it will have effect only in those parts or tissues where there's a receptor. The hormone has to combine with the receptor to bring on its effect. So suppose you are
Right.
taking a hormone which has got no receptors in your skin for that particular hormone, it will not have any effect on the skin. But if there are receptors present, it will have effect on your skin. So vitamin D receptors have been found even in the embryo, even in the egg, in the sperm, not embryo, endometrium, in the egg, the sperm, in the placenta also they have found vitamin D receptors. So in short, this is something we need to understand, that vitamin D deficiency, which can be so easily corrected today, has become an important part of evaluation of an infertile couple. We always do it routinely. We do the vitamin B12 and vitamin D in all the patients. Sometimes patients ask me, why are you doing my vitamin D3? I say, well, it helps you with your fertility, so please take it. And PCO patients are known to have a vitamin D deficiency. So in short, with the
Okay.
PCO patient, so we just give the vitamin D, even we may not do the vitamin D levels.
Okay. If this was
So
one topic,
sunshine,
yeah, Mr. and
yeah, sunshine in our country, but still no vitamin D, unfortunately, because none of us walk out in the sun. All of us are cooped up in air conditioned rooms, and we all are not exposed to the sun at all. Then that's why we say at least 20 minutes of walk every day in the sun will help you to absorb that sunlight, and which will give you your natural vitamin D.
Right.
That till the natural vitamin D doesn't come in, we take the artificial vitamin D to supplement it. That's what we do.
So, ma'am, when we are talking about these vitamins and minerals and all these things, I know many of my friends who have gone through this journey. There's a category named as prenatal vitamin. Why is that important in fertility
See,
patients?
prenatal vitamin actually is a vitamin mainly containing folic acid. Now,
Okay.
folic acid is a vitamin which is very important for the brain development of the baby whilst it's in the womb. Now,
Okay.
if you know, it's in the first 3 months of your pregnancy, the baby's organs get formed. Okay, they are getting formed from nothing, from all the cells which come from the embryo, right? The egg and the sperm have joined, they've made the embryo. From the embryo, the fetus develops. Now, whilst it's developing, if any insult occurs to it, like say if there is a exposure to radiation, or if there's an exposure to chemotherapy, or if there is an exposure to some strong medication, whatever organ is developing at that time gets affected. So, when the brain is concerned, if folic acid, which is a very important vitamin for the brain, if it is deficient in the body, then the brain doesn't develop normally. It will develop abnormally, and the spinal cord mainly gets affected. So in short, we have defects of the neural tube, as we call it. The neural tube is from where the brain and the spine develop. And if there's folic acid deficiency, this is what it causes. Now, to do your folic acid test every time becomes difficult. And every time you can't keep doing the test. So we normally
Right.
recommend to women that you start with your folic acid or your prenatal vitamins 3 months before planning a pregnancy. So at no
Oh,
stage is the embryo not exposed to that vitamin, which is so important for the brain development. So therefore, the concept comes of preconceptional counseling. How many
correct.
women go to the doctor before getting pregnant? That is something very important. We always tell our women that you are going on a 9 month journey and you're not even prepared for it. When you go on a flight, when you're going on a holiday, don't you plan your trip, where you're going to go and what you're going to do and how you're going to travel, what you're going to carry, which clothes will you carry, what tickets will you buy, etc., etc. Now you're going on this 9 month journey where that baby depends completely on you for its health. And you don't plan it. You just get pregnant. Like you're sitting on a train and then you decide, okay, now let's see where. I know we are going to have a baby, but we don't know how, what we're going to do for the baby. Are we in the fit condition to look after that baby? So the appeal through this channel is what I would tell women, that whenever you want to get pregnant, please visit your gynec at least 3 months before. Make sure everything is okay with you. Make sure you're healthy enough to carry the pregnancy. You don't have a problem which can harm you by being pregnant. And secondly, there's nothing in you which can harm the baby. It should start 3 months before. It can be as simple as having a thyroid problem. It can be as simple as having a mild diabetes. All these affect the baby long term. So it's important that everyone sees a doctor before they plan a pregnancy.
Wow, ma'am, that was really sweet, simple, very sweet and simple to ask any of the mothers and to guide them. I'm sure all our listeners are supporting them and they are going to do that. So moving
Yeah.
forward, ma'am,
Actually, I
I,
have a actually I have a nice book which I've written almost. It's in its 12th edition now. It's called Pregnancy and You, and it's meant for the Indian couple. And it's got the myths in it. It's got a nice chapter on in-laws and outlaws. It's fun reading, and it gives a lot of information. It's like a little book. I mean, detailed book where you get bored reading it.
ma'am, your
It's
voice
small
is
chapters.
not.
Oh, you're not getting it now? Are you
No,
okay
no.
now?
Yeah.
No? Okay, sorry, I was holding the speaker time. Okay, so in short, we tell women, I mean, the book is informative, very interesting to read, quick to finish, and it talks
Right.
about all this. I think it's a good guide for women before they get pregnant. And during pregnancy,
Definitely.
it helps them a lot. Yeah.
Wow. So, the ma'am, just like we discussed, Mr. and Mrs. Sunshine, I also read
Yeah.
the role of sleep. Why should a woman prioritize the sleeping patterns and the timings if she wants to have a healthy pregnancy?
Yeah. So, this is something like a new concept now about sleep, what really is happening with sleep, how it's affecting a woman who's wanting to get pregnant. What it says is that there is a hormone called melatonin in our brain, which
Right.
is secreted by the brain, and it helps the person to sleep and keep her hormones in a good circadian rhythm. What by which I mean, you see, the hormones, all our hormones in the body, most of them are released at different timings in the day. I mean, it's not like one single level you will get. It's always fluctuating up and down. sometimes in peaks of 60 minutes, sometimes in peaks of 4 minutes, sometimes in peaks of 90 minutes. Each hormone has its own peak. And there are circadian rhythms by which some hormones are secreted more at night, some are secreted more in the day. So what
Mm-hmm.
happens is that the body is used to a particular circadian rhythm where we are awake during the day when the light is on, when sunlight is present and it's day, we are all awake. And at night we
Right.
sleep because it's dark, and the melatonin gets released in the brain and makes you sleep. But with
Mm-hmm.
today's lifestyle, all of, I mean, so many women I've seen, they're sitting up till 2 and 3 in the morning and watching Netflix and watching Amazon Prime and watching all kinds of shows on, because that's the only time they get to see, because during the day they are busy. Similarly, and they keep awake late at night. Similarly, people who are doing night shifts, like say, air hostesses who work at any time of the day, nurses who have
Right.
night shifts. So where you have these shifts which are happening, and because of that, the hormones get disturbed completely. And when hormones get disturbed, because that pattern of sleeping is ruined every 8 days, 10 days, the pattern changes. So the brain is confused, and therefore, when these hormones are not released in the proper way, it can cause problems with reproduction, because melatonin has an effect on the egg. So, in short, if you don't have that melatonin being released in a proper way, you can have fertility issues because of that. The second reason can also be because of stress. When there's stress, there's a lot of cortisol hormone which gets released in the brain, and that affects the reproductive system. So there are different hormones which get affected with stress, with lack of sleep, and therefore, we say a good, healthy lifestyle is where you at least sleep about minimum 6 to 7 hours a day. There are those who
Right.
sleep more, about 9 to 10 hours, and there are some who sleep for just 5 hours. So there are different kinds of
Right.
people. There are people who can work better in the morning and less in the night mentally. There are some who can work
Right.
better at night and who cannot work in the early morning. So you get different kind of people whose brains have got used to that particular rhythm, and therefore you need to make sure that you get good sleep, you de-stress yourself, don't unnecessarily stress. The work will get done. Remain optimistic, be positive, and go through with life. And whatever needs to be done will get done. By stressing, it's not that it's going to happen any faster.
Right. So, ma'am, just now you said remain optimistic, remain positive. So, I know there are a lot of friends and there are a lot of patients we have who actually, once they start feeling that they are not fertile enough, they go in a very bad depression. They go in a very negative zone of their life. So, why
Hmm.
do you think on this? What is the role of optimism when it comes to fertility?
It's a state of mind, as you call it. There are some people who are very optimistic and there are some who are pessimistic. Like we always say, it's like whether the glass is half full or half empty, you look at it differently. So the question is, what has been seen, I mean, scientific studies have shown that when you're optimistic, means you think only about the positive things and don't think about the negative, your chances of getting pregnant or going through any stress is going to be much better. The result will be better. You'll be more successful. Whilst on the other hand, if you're very negative about everything, the chances of you doing, well or being successful or overcoming your problem is much lesser. So it's the vibes which are produced, and these are, as of now, science has shown this, but they've not been able to actually measure it. That is the problem. All the studies have shown that with optimism you're doing better, with negative, with pessimism you're doing worse. But we have not been able to really measure that and talk about it and say, okay, this is your reading, this is what you need to do. So it's more of scoring and through surveys, etc., that or meeting a counselor who can guide you on that. So I think let's learn to, even a woman say who's going through infertility treatment, you'll find that
Mm-hmm.
some of them get very depressed when the answer comes negative after an IVF cycle. And let's face it, there's nothing like 100% guarantee in science for anything. It's not like a math 2 plus 2 is 4. It's science. It's your human body. There are so many factors which affect it. So unfortunately, if it doesn't happen in that cycle, be positive and go on to the next one, rather than saying, "Oh, nothing is going to happen to me. I will never conceive," and getting depressed. Instead,
Right.
move towards your goal. Be optimistic, and try. Of course, it's not that you have to be realistic. So if a doctor tells you that sorry, it's not going to happen this way, we'll have to use another methodology, then I
Right.
mean, go with it. Of course, at the same time, do your own reading, be alert yourself, and see that you're on the right track. That's exactly what I would like to say.
Definitely, definitely, ma'am. Of course, anything when you're patient, when you're positive, things will turn into a two red line. We always say is very important.
Yes, absolutely, absolutely.
So, ma'am, moving forward, why don't you help us? How? Why don't you help women in general that how
How they can?
they can
I
promote
didn't
their
get
fertility?
you.
A quick bypass.
Okay, how they can promote their fertility. Good lifestyle changes, first of all. I mean, be healthy, exercise every day, eat healthy, avoid all carbs for no reason. Don't eat anything which you really don't like. I mean, once in a way you like, eat something, not that you don't, but follow a good healthy lifestyle and exercise. That's number one. Second thing is that if you have any sort of medical problem, attend to it quickly, see the doctor, don't delay it. Number two.
Right.
And then for promoting fertility, make sure that your periods are regular, make sure that you're taking all your, vitamins, basically staying healthy. And I think that is very important. And taking your medications, if you've been put on any treatment, take all your medications. Third is, of course, fourth is that you don't delay the pregnancy too long. I know I'm a career woman myself, but at the same time, when I had my babies, I was still too old compared to my other contemporaries from college who got pregnant by the time they were 21 and 22, and I had my pregnancy at 27 and 30. So it's a question of how much you delay. Now, as it goes today, most of our women are getting pregnant at 32, 33. So the question is, how late can you go? I would not recommend that. I would say have your babies early, get done with them. Being a career woman, take a 5-year back seat, have your babies, have them grow up, go to school, and then start back, get into your career full scale. So it's different for everybody. I understand, but age is a very very important factor. Your
Okay.
weight is a very important factor. I think these are the two things which you have to take care of.
So if I just the whole show that we have done, consult your doctor, prep for your pregnancy, just your flights, your shows, tickets. Please prep your pregnancy three
Correct.
months, month before you are planning to get pregnant. You should consult the doctor. Same time,
Correct.
healthy lifestyle, healthy things, it's healthy. Eating something very important, Mr. I hope I have not
Yeah.
missed it.
No, I don't think so. I think you're doing a great job. I think you had the right questions, and I hope it has helped our viewers.
Yes,
And
ma'am.
I would really feel happy that if I'm able to, pass on these messages to people, for their own good, it would be a very, very important thing. I think the other thing, one thing probably, if I have a minute more, is to
Of course.
warn young girls. If to warn young girls who are having multiple sexual partners, is to make sure that you're using protection in the terms of condoms, because what we are finding today is a lot of young women are picking up reproductive tract infections through sexual activity, and these infections can block your fallopian tubes and cause you infertility later in life. So even though there have been young women whom I say, use protection. She said, "Oh, but he's my only partner." But yes, he may be your only partner today. Maybe you had another partner earlier. Maybe he had another partner earlier. But infections go like this. How COVID has spread, you have seen it. People
Right.
living in the
Right.
same house, they infect everybody around. And that is because
Yes.
of the air which they breathe in and out. But when you're
Mm-hmm.
sexually active with a person who may have had many partners before, but he's not aware he's carrying that infection and he passes it on to you. You block your tubes in the bargain, you may pick up human papilloma virus, you may pick up HIV, you may pick up chlamydia, you may pick up gonorrhea, you may pick up syphilis, you may pick up any sexually transmitted infection, which may be totally silent without you knowing. So there are some of these infections which are very silent, you'll never know you had it. And those are the ones we dread. So use protection. That is another thing to tell for making sure that you don't develop infertility.
Right. Thank you. Thank you so much, ma'am. I guess out of all my shows, it was one very informative and a very enlightening session. And all the
Thank
mothers
you.
who are listening to us later, and if you have any
Sure.
other, please share it with us. We will make it.
Absolutely. I'll be happy to respond.
Yes, ma'am.
Okay.
Thank you. Thank you so much for taking out time from your busy.
Thank you. Thank you so much for having me. Thank you.
Thank you so
Bye bye.
much. Bye. Bye,
Bye bye.
mommies.
Bye. Bye bye.